I got stung by a bee, and I'm allergic.
When bees or similar insects sting a person, they inject venom through their stinger into the skin of the victim. About 3% of people stung by bees and wasps have an allergic reaction to the sting, and up to 1% of bee sting victims experience a severe and life-threatening allergic reaction known as anaphylaxis. Anaphylaxis is a severe, potentially life-threatening allergic reaction. It can occur within seconds or minutes of exposure to something you're allergic to, such as a bee sting. The flood of chemicals released by your immune system during anaphylaxis can cause you to go into shock, dropping your blood pressure and narrowing your airways. Other signs and symptoms include rapid, weak pulse, a skin rash, nausea, vomiting, and loss of consciousness. One of the best ways to treat anaphylaxis shock is through injecting epinephrine into the body. Epinephrine is in a class of medications called alpha and beta adrenergic agonists. It works by relaxing the muscles in the airways and tightening the blood vessels, which decrease swelling and also helps to increase blood pressure. It also increases the heart's contraction and heart rate, which can help to prevent or reverse cardiovascular collapse. Epinephrine relaxes the muscles around the airways in the lungs, helping the airways to open up. Finally, it prevents the release of additional allergic chemicals, which aids in stopping further progression of the reaction. One of the best ways to administer epinephrine is through the use of an EpiPen. The EpiPen is injected into the outside of the thigh when anaphylaxis shock is underway. Instructions are written and pictured on each pen. Read the directions carefully when you pick up your prescription. If your child is old enough to use the EpiPen himself, have him practice using the trainer pen that does not have medicine or a needle. Pull off the safety cap from the pen. Make a fist around the syringe so the tip is pointing down. Be careful not to put your thumb on the tip. If the pen is upside down, you will inject yourself in the finger. Hold tip near the outer thigh, swing and press firmly against the outer thigh until you hear it click. Hold it in the thigh for 10 seconds. It can be given through clothing if necessary. Remove EpiPen from the thigh and massage the injection site for 10 seconds. The needle cover will now cover the used needle. Call 911 and have the patient shipped out immediately.
Contraindications to the use of epinephrine include the following: dilated cardiomyopathy, Parkinson's symptoms, closed-angle glaucoma, high blood pressure, heart attack, angina, disease of the arteries of the heart, sinus tachycardia, abnormal heart rhythm, hardening of the arteries in the brain, blood circulation failure due to serious heart condition, overactive thyroid gland, diabetes, bleeding causing blood pressure or heart problems. It is important to be aware that in an emergency, life-threatening situation, there are no absolute contraindications to the use of epinephrine. As with most prescription medications, epinephrine may have possible side effects. Patients with certain medical conditions or who take certain medications may get more side effects from epinephrine, or the side effects may last longer. This includes patients who take certain types of medicines for asthma, allergies, depression, hyperthyroidism, high blood pressure, and heart disease. Epinephrine can cause the following reactions. Some reactions can be serious, however, they usually go away with rest. Common side effects of epinephrine include the following: faster, irregular, or pounding heartbeat, throbbing headache, paleness, feelings of overexcitement, anxiety, or fear, weakness or shakiness, dizziness, nausea, vomiting, and sweating. As with any prescription medication, please be sure to tell your doctor about all medications you take before use.